Hey folks, Dr. Starr, Silver Spring Medical Center. Just wanted to welcome you today. We got another 5-minute question of the day. Many times patients will ask Dr. Melmid and the medical staff, I'm taking my medicine the way it's recommended and prescribed, but I'm still hungry. What do I do? So it's not an extremely common question. The truth of the matter is, let's take a couple steps backwards. The body for sure is not designed to run on low calories forever. The only reason why we do this part of a medically supervised care is because we can do it properly and with proper supervision and in a controlled environment. Your body is meant to run, and if you remember the BCA, or the body composition analysis, the computerized analysis, shows that your body typically will burn somewhere between 1,200 and 2,000 calories per day, depending on how big you are and how active you are. So, for you to be consuming 5, 6, 7, 8, 900 calories per day, depending on where you are in the program, your body is absolutely going to say that's not enough, and then what it will do is seek out other sources of energy and fuel in your body, primarily fat, which most Americans have plenty of, and use that as the fuel. So it's fine for the short term, but not for the long term. People will not thrive long term on a low calorie diet. You're just not meant for that. That's not how your bodies are designed. So, the desire to be hungry, or I should say the signal or the alarm system that your body throws in your face is, hey, I'm hungry, feed me. That is a normal, thank God, normal response. Without that, you would die, right? If you were just forgetting to eat because you're busy, because you have a big project tomorrow, or you got your kids' basketball games to run to and carpool, and you forget to eat for a couple of days, you'll die. Well, I mean, not really. And if you don't drink for 2 or 3 days, you'll probably die, but you can get by without food for several weeks, only because we have a lot of stored energy, again, in the form of fat. However, it is a good alarm system. So when you're on the program, and if you're having indications that you're still hungry, that's okay. That's normal. Most of the time, it is quelled properly by the prescription medication that Dr. Melmid, recommends and prescribes for you. If it's not enough for your particular case, so here are the things that you can do. On your next visit in the office, mention that to the medical staff. Mention it to Dr. Melmid. He may either increase the dosage, or he may put you on a different kind of medication, or he may give you an additional medicine. So those are several options, obviously, to be discussed with your physician. The other potentials are, we have other tricks to quell the hunger feelings that your body's having. And we have something called HCG. If you're not already taking that, again, ask about that in the office. It is this is not the time for it, but it's a hormone that your body secretes that is called human chorionic gonadotropin, and it does have a nice effect of making you not feel as hungry. So that is certainly one. It's a 30-day regimen. We either give you orally, or we give you the syringes to do it at home. You can give yourself a very small injection with a diabetic needle. You don't feel it. It's very easy to administer. It's highly effective. People can easily lose 20 to 25 pounds, male or female, just depending, in that first month. And it's a very, very effective. Personally, I've done it. Dr. Melmid has done it. Dr. Green has done it. It's a very, very effective method. So if you haven't done that, that's something you may want to consider. Another thing that we have in the office is the natural supplements. These are non-medicinal, non-prescription, natural supplements that either, depending on, there's 2 kinds, Formula 1 and Formula 2. Formula 1 is more for people who feel more hungry during the day, so you take it throughout the day, and it curbs your appetite. There's a Formula 2 for people who are really hungry at night when they go to bed. A lot of patients will take both combination, or sometimes you just pick one or the other. So those are extremely helpful. The other possibility and option is that you happen to have a higher rate of metabolism, and your body simply burns more calories. Maybe you're more active. Maybe you're just larger. Okay, I'm 6'2". I'm a big guy. I burn more calories than somebody who's 5'2". So if that's the case, we may have to modify the number of calories that you take in per day. If you're on HCG and only doing 500 calories, you may have to take 6 or maybe 650 calories in a day. Got to keep track. You got to log in that information. If you are at 700 or 800 calories per day, you may have to go up 100 or 200 calories. That's okay. Your body's still going to lose. So those are the options to do. The key is to keep communication. If you're hungry, you're having side effects, positive or negative, let us know. All right? We're at 5 minutes. Have a great day. Thanks for listening.